I was really excited when I heard about Southampton Mental Health Network. I'm a big believer in networking, in working together rather than on our own, or thinking we've got all the answers when we haven't, and just to hear what else is around, not only just to signpost and network, but to link up with other people who have a same desire as us to help relieve people who are struggling with whatever challenges they've got in their lives.
My take on mental health, or mental wealth as I like to call it, gives the idea of it being something that we can build and something that we dip into at times, but then actually we need to invest in it again so that we've got that resource of resilience. So my connection with the Wellbeing Network is from that angle, from an organisational angle.
I think it's really important that we get together a movement that is going to help the attitudes towards mental health in Southampton and have much more understanding and education about mental health. I also want to know who else is out there to network my clients into there when they have a problem, and to know that we're all trying to help people by finding out what's right for them individually. I also want, of course, publicity to be able to let other people know about what we're doing and what we can offer.
So at St Mary's Fire Station we've set up a team of engagement people, and we're looking to go into people's homes, vulnerable people's homes, to put up smoke detection and carry out what we call a safe and well visit, which will highlight any areas within the home that potentially could cause a hazard to the occupant. We've also highlighted that a large percentage of people that have unfortunately passed away through fires are people with mental health issues. Therefore, if we can get into engagement opportunities like this, hopefully get into the house and do that prevention work so that we don't have so many fatalities with people who do have those issues.
So my name's Annie Clulo, and I have had the privilege of leading the Southampton Mental Health Network through to where it is today. The organisation started life, as I said, back in 2019, February of 2019, so less than a year ago. We had 12 members, of whom 9 met around the table. We now have around 100 members, and that includes 50 organisations and then individuals on top of that. The network is all about getting hold of the idea that if we're going to be successful in our society at being able to support people, whatever level they're at with their mental health and well-being, to be able to live a happier life, then we've all got to be in this together. I'm going to hand over to David, Prof Kingdon, who is going to speak to you about the importance of this network and what he hopes it's going to achieve.
I was a psychiatrist for 40 years, retired last year, but I still work as an academic. I worked in Southampton for 20 years and really saw community psychiatry has been essential to any sort of work we can do in terms of developing health and well-being, particularly mental well-being. People talk about Thrive now, and that's the term. We talk about mental health in Southampton. Now we've got Thrive New York and Thrive Manchester and other things. And a lot of these sort of ideas about thriving, trying to use networks, bring people together, is what really the network can most helpfully do. It's very difficult when the resource is constrained and focused on people who are particularly ill. There's also an issue of the amount of resource that is around in general practice, in A&E and elsewhere, and how can we help link people with the things they need, which often aren't physical health care. They're actually things around problem solving their life's problems, and being able to help people get connected with services. And that means more than, it's not signposting, it's linking.
But yeah, so thank you all for coming. And that's it from me.
Thanks, Chloe. That was her debut doing any of these events. And, good job. So all the hard work that's gone into this primarily has come through Chloe. So thank you, Chloe.